One other issue related to this is the president and others have talked about saving American jobs through this legislation, through the creation of a new industry, basically. There are certain Buy American provisions in that stimulus bill which may inherently cost us a lot more money. How do you feel about those things? And also, we only have a few minutes left here. A big question about the simplification of the tax code, which some people argue is a new way of saying that we are going to be attacking the things like the indefinite deferral of taxes on income earned outside of this country, which is some $700 billion, they estimate, that's sitting out there someplace. That's a lot I'm asking you to respond to, but these are things on people's minds.
Yeah, the tax code, first of all. I'm on the tax writing committee. I'm a new member. It's the Ways and Means Committee. It's the most exclusive committee in the House. And tax simplification, we need it desperately. There are so many different sections and codes of the Internal Revenue Service law, and we definitely need some simplification, some consistency moving forward. So I think that's very, very important. I think, the other issues with respect to changes that will occur in the American economy, we're doing healthcare right now, which is very, very important, and it's 18% of our gross domestic product. It's 18% of the American economy. It's breaking businesses. It's breaking individuals. And in terms of American competitiveness, we have to get a handle on that because we're paying more than any other industrialized nation for health care, but our clinical outcomes are increasingly worse when compared to other industrialized nations. So, I'd like to see, health care be a major driver of the change in this economy. And, you don't have to look to Europe. You don't have to look to Canada for an example as to who does it well. You need to look right here in America. And there's places like the Cleveland Clinic, and there's places like the Mayo Clinic in Rochester, Minnesota. These are not for profit, lowest cost, highest quality health care in the entire world. Why are they the exceptions and not the rule? People in Buffalo and Western New York, even though we have a very impressive healthcare infrastructure right here in Buffalo and Western New York, people on a regular basis travel to Cleveland.
Right.
Why? They're drawn because of the quality. Well, what happens at Cleveland, again, it's not for profit. Physicians do what physicians are trained to do. They're not making money because they're ordering a lot of unnecessary procedures. They're concerned about the health care of the individual. So they collaborate with other physicians and the patient to figure out, here are your symptoms. Here are your options. Here's what's worked for other people. Making decisions to keep people healthy, I think, is good for the economy of the nation because, as you talked about, Social Security, Medicare, these are huge, huge expenditures now and moving forward. So what is it that we can do to begin to control the growth of those expenditures? And I think healthcare reform is fundamental to that.
I agree with you, and I think it goes beyond even healthcare reform in my mind. It goes to our lifestyle in this country, behaviors that are inherently destructive to our physical being in such a way that we compound the problems, all the problems that you suggest, and certainly raise the cost along the way, which is why I think the more progressive organizations in the health-related industries today are looking at ways to help people modify their own behaviors to change their lifestyles so that our true costs come down because there's less demand.
Yeah. Can I just, on that quickly, 70% of our healthcare dollar is consumed by what's referred to, economists and healthcare specialists say, is the disease burden, attributed to obesity, attributed to lack of exercise, attributed to smoking. I spoke with the CEO, Dr. Cosgrove, at the Cleveland Clinic, and my question to him was, what is it that you do? Why does everybody reference you as where we want to be, and why are you the exception and not the rule? And it's a tremendous culture. But he says, their emphasis is also on preventive care. He said at the Cleveland Clinic, we will not hire somebody that smokes. But at the same time, they offer free smoking cessation classes to all of Cuyahoga County where they operate, and there has been a 10% reduction in the incidence of smoking. So, they put their money behind their rhetoric and their commitment behind their rhetoric, and what they've created is a highly efficient healthcare delivery system that should be the model for a United States healthcare delivery system.
I think if you look at locally, Brian, you'll see that there's some very good examples of the very same thing. Univera, for example, has incentives to its members to behave better. If you exercise, I mean, there's built-in incentives. So the Cleveland Clinic isn't alone in that, and I know you know that, but as I said, the more progressive, the better thinking health organizations in this country today are looking at the cause as well as the effect of our health issues in this country. And I agree with you. I think we've become a nation of great repairmen in the medical world, and I think that's a wonderful thing, but we need to look at the root causes. I'm sorry we have to go. Representative Brian Higgins, thank you very much for being with us today.
Thanks, Peter.
I'd like to thank all of our listeners, and I apologize to the many people who called in, but I want to take advantage of this time that I have with Mr. Higgins to hear his thoughts. Thank you very much for being with us. We'll be back next week at the same time. Remember, when it comes to real estate, Western New York is our house.